How's healthcare doing? That's a tough question. Not so good. Our system in the U.S. costs a fortune, about 50% more than any other country, and the results are not very good. So we're not doing well at all in terms of value. And in the rest of the world, there are a lot of issues of access and equitability between economic classes in different countries. So there are a whole lot of challenges out there, a whole lot of problems. And part of what's fascinating about the health sector is they're all tangled together. Values, human culture, politics, funding. And to untangle them is essential in starting to understand what drives what we have and how we can improve it. The Institute can be helpful in dealing with the tangle of health and healthcare by sorting through all the forces and all the elements that are at play, understanding them, defining them, and potentially studying them, and convening people from across the typical categories of expertise and industry areas so that people can look in an integrated way concerning what's happening, how things are operating now, and how value can be improved in the future. A major research university like Boston University has tremendous capacity that can be brought to bear in terms of understanding and improving the healthcare system and healthcare. An institute sits within the university and in some ways can access those resources, but it has to support the mission of that university which has created it, and that means education and research. At the same time, it has to bring in resources to support its own activities, which means bringing in funding and other capacities from the external world. And to do that, it has to create impact that's of value externally. So an institute sits between the university and the external world, creating simultaneously value for both as a way of making it work. That's the magic sauce of an institute. There's hardly anyone in the sector that doesn't talk about improving health and healthcare, and everyone has his own solution or his own story of what would add value. One of the challenges is, first, that's based on their own perspective from where they sit, and second, all the parties involved have a financial interest in what's going on, whether it's insurance, service delivery, or even academics, for that matter. So it's hard to get clear understanding and information about what really makes a difference. The discipline of research and data-based analytic work is that it provides evidence concerning what's really going on in certain areas, which allows you to make judgments based on the reality of what's happening and not the interest or stories or opinion of people involved. I've spent my whole career in health, human services, working with people and running organizations that made a difference with people, whether it's a health insurance plan or a primary care center. And I've reached the point where I think the system itself has to change and value has to be created through innovation. And simply operating in the same ways is not going to give us what we need. The Institute is a chance to have a platform with all the complexity that it brings to make a difference, to support innovation, to understand what will improve healthcare and health, and to be involved and engaged in doing that. That's why I joined the Institute.